Hi, and welcome to the show today. Today, we're honored to have Dr. Nabila Noor. Welcome to the show, Dr. Noor.
Thank you so much, Dr. Hester, for having me. I'm very excited for our conversation.
Oh, it's an honor to have you. So let's get started by having you tell the audience all about yourself.
Absolutely. So, my name, like you said, is Dr. Nabila Noor. I'm a board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. And I currently practice in Allentown, Pennsylvania, in the United States. So, I take care of women with various different kinds of pelvic floor disorders, which could range from things like urinary leakage, pelvic organ prolapse, bowel issues. I have a fair amount of patients who come to me because of injuries from childbirth, recurrent urinary tract infections, pelvic pain, bladder pain. So it's a whole host of, conditions that include
Absolutely.
surgery, some medical conditions. So it keeps it very interesting.
I know there's a whole lot going on, and I was very intrigued. We were talking earlier about the impact that this has that women, I think, at least in America, may not think that much about, but in other countries, I mean, this goes beyond life changing. So tell us a little bit about that.
Yeah, no, absolutely. I think you're very right, right? Because, one of the things I tell my patients, and which is the truth, is that, most of the conditions that I treat are more quality of life as opposed to life threatening. But I think sometimes we forget that these quality of life issues over time can have significant impacts. So if you think about a
Absolutely.
woman who's leaking urine, right? Whether it's somebody when they're 30 years old or somebody when they're menopausal, 60 years old, or somebody who's 80 years old. I hear these stories all the time. Women say that they're avoiding doing activities they used to enjoy. They avoid things like going out with friends or playing outside with kids. My older patient population, they'll avoid going out with socialization. They're avoiding intimacy with their partners. And what happens is over time, these little things can really affect them at a whole, like, when we're talking about mental health, right? And we have a
Hmm.
lot of patients who go into depression because they're isolating themselves, and so I honestly think, yes, it's not life threatening, but it slowly kills you because you're really kind of suppressing yourself from enjoying all the things you normally would enjoy. And I think to our conversation earlier, if you think about it at a global level, I mean, that's a whole other concern, right? I mean, I'm originally from Bangladesh, and one of the reasons I got interested in urogynecology was because as a fourth year medical student, I had the opportunity to do an away rotation where essentially we took care of women with pelvic floor issues, which was primarily urinary leakage as well as pelvic organ prolapse. So a lot of my patients at the time were young women who maybe had a traumatic vaginal delivery and then ended up with pelvic organ prolapse, which is essentially a kind of vaginal hernia where their pelvic organs are coming out through the vagina. So at its worst, these women are walking around with what feels like a ball in between their legs, where essentially their uterus, their bladder, for some women, their rectum is falling through. And these are young women, who maybe had one child or maybe two children. And because of what they have, and because the lack of awareness of the society of what these conditions are, these women were basically living a life of exile where, their husbands were leaving them, their family members didn't know what to do. And these women were basically social exiles, which is terrible. And we do these treatments, whether it's surgery or for some patients, it could be non surgical options, and their life is completely changed. It's so gratifying to be able to do that.
It's hard to imagine that, particularly a 20 or 30-year-old, she has a child or a couple of kids, and then her husband doesn't want to be around her. That's kind of hard to fathom in America. And as far as going to the store and buying the pins, they may not be available in a lot of places. And
Oh,
so
absolutely.
just the emotional thought of going around wet, smelling like urine, I can see why women would just want to withdraw. And so with the withdrawing, then there's the depression and everything else that goes along with that. And
Absolutely.
so, while it may not be an acute heart attack for that woman, it may as well be
Yeah.
because her
You know,
life
I'll,
is
I'll tell you an
essentially.
interesting story because it actually happened a few days ago. So it's like fresh on my mind. So I had a patient who basically came to me. I was the fourth physician she saw for urinary leakage. And, she's basically been shipped from one specialty to the other, never really been referred to a urogynecologist for her urinary leakage. She finally came to me. We diagnosed her, we treated her. We ended up doing a sling procedure, which is basically a 15-minute surgery, outpatient surgery that we do, that basically helped her improve her incontinence. And I just saw her at her post-op visit, and she was just beaming. She was so happy. But the thing she said to me that really kind of touched my heart was, she said, "Dr. Noor, my daughter hugged me and said, 'Mommy, you don't smell like urine anymore.'"
Oh,
And it just, and I don't know why, but there's something about how she said it. Like, you could just see all the emotions in her eyes. It's the pain, the suffering she had all this time, happiness.
yeah.
And it was just wonderful. It was just so wonderful and beautiful.
Oh my gosh, I'm sure. Uh, so, that was very emotional. Just imagining,
Yeah.
because I have kids.
Yeah. Absolutely.
Just imagining the pain, the humiliation that she went through for so long. It's
Yeah.
just
Yeah.
it's
And, and
difficult
it's
to
funny
think
because when
about.
it's our kid having an accident or have an issue, we as mothers rush them to the doctor. Like, that's like the first thing, right? That's your priority. And as women, you know, we're the best caregivers. We take care of our kids, we take care of our husbands, our parents, our patients, and yet prioritize us the last and we
Last,
do that as physicians too, right? I mean, we are the caregiver and yet we don't take care of ourselves. So yeah, it's very prevalent.
and women in general, all around the world, that's the expectation that everybody is going to come first.
Yeah,
And if there's anything left, then you can take care of yourself.
absolutely.
But what people fail to realize, just like when you get on a jet and they say, put your mask on first so
Yes.
you can help the kids. If you are not whole, whether it be emotional or physical or whatever the case may be, um, you're going to be subpar taking care of other people. And
Yeah, and I
so
think
the thought of self care for women that really needs to take center stage.
yeah. And I'm glad you say that because that's really the conversation that I have with my patients, right? Because when patients come to see me, we go through all the treatment options, and oftentimes their reaction is, "Oh, it's not cancer. It's not getting any worse, right? Okay, I'll hold off on it." And then, I ask them, "Well, what brought you to my office? It obviously was bothering you enough that you made that trip, you made that appointment and came to me, right? So it is affecting you. It is stopping you from enjoying life. It is preventing you from doing all the things you would like to do. So if you're suffering and you're limiting yourself, then that's a sign that you need to take care of it." And I think when you break it down like that, they're like, "Yeah,
Mhm.
you're right. Like you said, it's not killing me. It's not cancer, thank God. But it is, because I've made peace with it for so long that you forget how life could be on the other side." And I think part of our conversation is kind of showing them the picture that what life could be like when you're not worried about your bladder, when you're not worried about your bowels, and you're not worried about a ball in between your legs, and you are dictating your life, not the pathology that you're dealing with.
And you matter. You are important. You're as important as everybody you're taking care of.
Absolutely.
And you need to prioritize your health as well.
Absolutely.
So let me ask you this. As far as a woman dealing with these things, do they typically need to be referred by a primary care doctor or can they self refer? I'm having this issue. Let me seek out the urogynecologist.
Yeah, no, I think that's a great question. And you're right, because I am considered a specialist. So as a specialist, a
Hmm.
lot of my patients who come to me are patients who've either gone to their primary care doctor or OBGYN and were either diagnosed or they mentioned these conditions and then were referred to me. But having said that, I think if you, even after having this conversation, if you're somebody who is like, "Oh, I'm leaking urine here and there's nothing normal about that," and you talk to your primary care doctor or your OBGYN and they're just telling you, "Don't worry about it, just do your exercise, it will get better." And if you're not satisfied by that answer, by all means feel free to find a specialist in your area, call them up, and we'll be happy to see you. I have tons of women who self-refer themselves.
Well,
And in
that's good
fact,
to know.
yeah, absolutely. And in fact, now I am getting more vocal on social media primarily because, I think the onus is on us as physicians to reach out to our patients. I think how we practice medicine, even 5 years ago is very different than how we practice medicine now. Before I would be happy seeing my 2025 patients in the office, but now with social media, there's such a big reach. I think it behooves us as trained board certified physicians to be reaching out to the larger population. And yes, I'm not going to see all the patients in my office, but if I can educate them, if I can make them aware that, hey, this is not normal. There are treatment options. There are specialists who take care of these conditions. Then they can take that information to their primary care doctor. And maybe their primary care doctor wasn't even aware that this is something the patient's suffering with, and then get them the referral or get them to the specialist that they need to see.
I
So
agree.
I'll tell you, I've had so many patients find me on social media, travel like an hour or so to come see me. So yeah, absolutely. Self-referral is always is a good idea.
That's important to know. And realistically, I mean, most of my career I was a hospitalist, but I was a primary care doctor as well. I have to wonder how many internal medicine doctors or family care or family practitioners will actually do a pelvic examination when a woman says, I'm leaking.
Yeah.
So they have no idea what's actually going on down there. And a woman may be so used to that bulge, she may not even mention it. It's become a part of who she is. And so
Absolutely.
that may not even be explained to the doctor. So the doctor is just thinking, okay, in bladder instability or whatever the case may be. But it's great that women do have an option to self-refer.
Absolutely. And I think it goes both ways, right? As primary care doctor, you're dealing with so many things, right? Somebody can have heart issues, diabetes, they can have lung issues. And if you're going through so many things in the limited time, talking about their pelvic health, if they're not bringing it up themselves, may not be on your priority list, right? And I think that's why I love doing these podcasts and I love talking about, urogynecology as a specialty, because truth be told, a lot of healthcare providers even don't know that urogynecology exists because we're such a new specialty. And similarly, with regards to from the patient side, because they've lived with it for so long, and maybe right after childbirth symptoms started and they were told, oh, it's normal, it will get better, and then they go through menopause, it got worse, and then her girlfriends are telling them, oh, everybody has a little bit of leakage here and there, not a big deal. So she probably has been suffering with it for decades, and by the time they come to me, it's a lot worse than when it was how it initially started. And so that's what I want to change, is that, yes, a lot of these conditions that we're talking about that I treat are very common in women. It can actually worsen with age as women go through menopause, but they're not normal, right? It's time that we don't accept that this is what we have to live with. And whether it's in this country or other parts of the country, at least have a conversation. Not everybody I see is going to undergo treatment, but at least my job is to educate them, let them know what the options are so then they can make the best decisions for their lifestyle.
And you made an excellent point that when you're one on one, I mean, if you have 15 minutes, you can educate one person.
Correct.
With social media, for the time that we're spending here today, I'm hoping that you'll be able to educate hundreds of people. And
Absolutely.
so once they learn,
Yeah.
they can tell their neighbor and their sister and so forth. And so the potential is enormous.
Absolutely. And thankfully, there's social media everywhere around the globe. So somebody may be in a location where they may not have access to a specialist or a doctor in their neighborhood. But with social media, they can learn about it. They can be aware. A lot of the non-surgical treatments, they can even start some of the self-treatment themselves, when we talk about pelvic floor exercises. And then, they can start thinking about it, learning about it, and investing in it. And that's really what's important.
So I want to talk more about these exercises, but we're going to take a quick break and we'll be right back. Hello, I am Coach Dr. Ann, and welcome to the world of women wellness warriors, other known as WOW. A 2024 report by the World Economic Forum and the McKinsey Health Institute noted that each year women lose approximately 75 million years of life due to poor health and early death. The world of women wellness warriors is a global sisterhood of women who want to be empowered. So we're back with Dr. Nabila Noor, and I want to talk about the pelvic floor exercises. Can you delve into that for everyone?
Yeah, absolutely. So before I do that, let's talk about what the pelvic floor is, because I think a lot of the times patients are like, what is the pelvic floor? So the pelvic floor is essentially a combination of muscles, connective tissue, and ligaments, which essentially forms the base of our body, and it's helping support our pelvic organs, which could be the uterus, the bladder, the rectum, the intestines. So when we talk about pelvic floor dysfunction, essentially what that means is that our pelvic floor muscles or the organs that it's supporting are not working the right way. And there's a lot of different risk factors for that, right? We kind of touched on a few before: age, menopause, trauma from childbirth, pregnancy itself, genetics, chronic constipation, chronic cough, anything that puts a lot of pressure on your pelvic floor muscles. Obesity is a big one, can cause those muscles to get weak. So when we're talking about pelvic floor exercises, the idea is that, you're strengthening those pelvic floor muscles. And just like any other muscles in the body, when you can strengthen those muscles, it can help support and lift those pelvic organs well. So when pelvic organ exercises come up all the time is when we're talking about the different treatment options for a lot of the dysfunctions, pelvic floor dysfunctions that we're talking about, whether it be urinary leakage, bowel leakage, pelvic organ prolapse, pelvic pain. So what pelvic floor exercises essentially entails is a very specialized group of exercises that, patients can do to help improve the health and the strength of their pelvic floor muscles. Now, I will add, a lot of the times people think pelvic floor exercises and it's Kegels, and it is. A lot of the times it is Kegel exercises. But again, depending on what your condition is, a lot of the times we focus on pelvic floor muscle relaxation. So I think working with a qualified pelvic floor physical therapist, or again, making sure you're being evaluated by a specialist, can be really helpful to make sure you're doing those exercises correctly and for the right reasons.
So, what are some other treatment options in addition to these exercises? Let me go back.
Hello, I am
So,
Coach Dr.
is it
Ann.
safe to
And
say
welcome to the world
that
of
as a
women
urogynecologist, you
other
would
known
see
as
someone
WOW.
and you could
At
give them
2024,
handouts and
by the
explain
World
to them
Economic
what to
Forum,
do, and they can start
Health
doing
Institute,
this, building up their
each
bodies on
year,
their
women
own,
lose
and then
approximately
follow up
75
later?
years
Is
of
that
life.
due to
Yeah,
poor health
absolutely.
and
When,
early
when
death?
patients actually
The
come to
world of
see me
women
on their
wellness
first
warriors
visit, right?
is
Because
a
everybody's
global
very scared when they
sisterhood
see, oh, I'm
of
going to see
women
a
who want to
surgeon,
be
and they think all
empowered.
I'm going to do is just offer them surgery.
Yeah.
And that's far from the truth, right? So when patients come to see me, we're doing just like when you go to see your primary care doctor, we're doing a good detailed history. And then I'm doing a very detailed pelvic exam, which may be a little bit more involved than just your regular GYN exam, because we're doing a lot of measurements. We're trying to see whether or not you have leakage. We're measuring the laxity of your pelvic floor muscles, how tight your pelvic floor muscles are. So there's a lot of things we're trying to do. And then after we do a full evaluation, we come up with what your diagnosis is. Now, depending on your diagnosis, if you're very early stage in any of your pelvic floor issues, or maybe you're somebody who's like, Dr. Noor, I want to be very conservative. I don't want anything invasive. That's when we talk about non-surgical treatment options. Now, I will say, not doing anything is always an option, right? Because again, remember, everything I do is quality of life. Oftentimes I have patients who just want to get themselves checked, and we talk about they have maybe very early stage conditions, and all they want to do is just observe and then follow up as needed. That's totally fine. If there's nothing concerning, I never have to force the treatment options on patients. So together we come up with a plan that works for you. And so for most of my patients who maybe have early stage pelvic floor issues, but they want to be conservative, that's when we come up with whether it's pelvic floor exercises, and there's some other non-surgical options that we talk about and come up with a plan that's specific to them. And that could entail giving them a handout about how to do the exercises. Like I said, I'm pretty active on social media. I have a lot of videos that I often refer my patients to so they can kind of see it. There are a lot of really great pelvic floor physical therapists who are online, who are doing a lot of these exercises, showing patients how to do them correctly. So those can be really helpful. But the important thing is to do them right, and the money is in the repetition.
So, if I'm hearing you correctly, women around the world who are dealing with these very traumatic issues could potentially see some of your videos or read some information and do things no matter where in the globe they're located that could help turn their lives around.
Absolutely. And I'm so glad you said that because, one of my pet peeves, and I say this all the time, I'm like, why is it that women find out about my specialty only after they have suffered for decades or they've had a traumatic childbirth and now they're having complications? why aren't we talking to young women, right before they're thinking about getting pregnant? Like, what can they do to prevent issues with pelvic floor, during childbirth and after? Like, just like we talk about, okay, gestational diabetes or complications that can happen to you with pregnancy, pelvic floor should be a component of that discussion. And in fact, I recently had a postpartum patient who came to me, and she actually pointed it out to me. She was like, how we have classes for new moms about how to take care of your babies and how to breastfeed? We have lactation classes. Why don't we have a class that talks about how to take care of your pelvic floor, how to take care of your pelvic health?
Wow,
And I thought, what
great
a
idea.
brilliant idea. Like, why aren't we doing this? Let's do this. So that is something that I'm actually working on, is to maybe, come up with a guideline that, women can read and at least be aware that, yeah, guess what? Like, after you have childbirth, that baby comes out through the pelvic floor, everything gets stretched, it can cause some damage to the nerves, you can tear, you may have to get an, surgical incision. We call episiotomy. A lot happens that can affect your pelvic floor. And you may notice some leakage, you may notice some bowel issues, you may end up with complications, but guess what? You don't have to suffer with it for the rest of your life, because number one, there are things that you can do to reduce your risk. And in the rare situation that you end up with a complication, there are physicians who specializes in taking care of you, and they can help you. Like, why aren't we giving all this information to young women so that they can make the best decision for themselves?
This is tremendous. As we talked earlier about the impact and the stigma of incontinence, women who may live in a country where they don't have access to all of these things, just being able to look at a video or read some information and not investing, an arm and a leg and then live on the other side of the world, you
Absolutely.
know, this is I mean, it's beyond awesome. It's wonderful just to think about how many people could potentially be helped with this.
Absolutely. Yeah. And I know, and I think that's why I love, what you're doing, and, people like you, who are trying to reach out to women, and not just within the US, but really like a global reach. Because, with the internet, we live in a world where we don't have to travel to reach out to somebody who
Yeah.
lives thousands of miles away, right? We can do this from the comforts of our home. And similarly with patients, I do a lot of patient education webinars where a patient can just put in their email and then log in, and it's all anonymous, and they could be, in their living room, or they could be in Africa and just log in and be
Hmm.
able to hear all the things that we're talking about. Now, yes, I do agree what treatment options are available may vary from country to country. But again,
Hmm.
knowing that those are some options, what you can do, focusing on more prevention, especially for the young women or the young patients as they're making, life-changing decisions, whether it be with pregnancy or childbirth, can be really beneficial.
Mm. This is tremendous information. I'm really excited. I'm in my mind. I'm trying to think of what I could do next to try to promote this because the potential to really impact women's lives is
Yeah, no,
huge.
absolutely. I think, one of the things that I'm doing now is kind of working on a little bit of kind of like an ebook, right? That, like I'll put the link on my social media. If people put in their email, I can send them an email, which again will talk about what are some things to be wary of, or simple things, right? Like when you go to see your postpartum physician after you have a delivery, a lot of the times I feel, of course, the focus is on the baby, and of course, it's a new life, but once a woman have delivered, we forget that she needs care too. She needs support. She is healing. And, as a society, I feel like there's so much focus when a woman is pregnant, and then she has the child and it disappears.
Yeah.
And God forbid, like, later life, right? Once she goes through menopause, it's like you're forgotten altogether. So in urogynecology, I have the luxury where I'm seeing women who are in their early stage. I'm seeing women who are going through menopause, so that big transition in their midlife, and then women who are much older. I have patients who are 80, 90 years old, right? So I see a
Wow.
whole gamut of women starting from age 20, if not younger, all the way up to 90 and even older sometimes. So I really have a chance to see them at different stages, see the struggles. And I really feel strongly about um, the emphasis. I think, even though I'm a surgeon myself, I love doing surgery, but really focusing on prevention and focusing on longevity and quality of life. It's not just about living longer. You want to live a fulfilled life. whether you're a 20-year-old or whether you're an 80-year-old. Sometimes patients come to me and they're 80-year-olds and they're like, Dr. Noor, I don't have to deal with this. It's fine. I've dealt with it for so long. I can manage. And my response to them is, if
You
you're
don't have
otherwise healthy, you don't have to. We have been conditioned to think that that's okay. Like, yeah, wearing a diaper is not a big deal. Yeah, it's not killing you. But can you imagine a woman who is smelling like urine all the time and doesn't want to go out, doesn't want to go to her grandson's graduation because she's scared? What if there isn't a bathroom and then she's going to wet her pants? She doesn't want to, kind of, she doesn't want to like be a burden on her family. So she basically just restricts herself and doesn't do anything that she normally would enjoy. It can really take a toll.
And what if that woman needs a diuretic for heart disease
Oh,
and doesn't want to take the diuretic?
oh my God. I literally exactly what you're describing. I had a patient yesterday and poor thing. And, we all have our limitations. And I felt bad because I knew that there wasn't much I could do. But, this is a patient who's morbidly obese, multiple health issues. Just like you said, she has lymphedema. So she is on a diuretic. She has major back issues. So she's on a wheelchair. So again, having that nerve damage is affecting her urinary leakage. And she's in a diaper. And basically her frustration was, Dr. Noor, like even with the diaper, I'm wetting my pants. Like this is not a way to live. And my heart goes out to them. And we're hoping, eventually with more research, with more, research in clinical science and developing new therapies that we will go beyond what we have as treatment options. But yeah, I mean, this was a patient that I really felt that, we have tried a lot. And unfortunately, I'm at my wit's end about how much more I could help her. But say this woman came to me 30 years ago
Mm-hmm.
before any of this happened, maybe I could have helped her in a different way, right? So that's what I'm trying to focus on now.
Do you want to go into any other treatment options?
Again, depends on your time, whatever you think is appropriate. I know we covered a lot, but yeah.
So, what would you say is other than the pelvic floor exercises, what would you say is the most commonly performed procedure?
Yeah, so pelvic floor exercises, is a form of non-surgical treatment options.
Mm-hmm.
But thankfully, nowadays we have some amazing minimally invasive surgical techniques. And what that means is that, before we used to do these surgeries with a big incision in somebody's abdomen, right? And now we can do these surgeries with tiny incisions. And sometimes we do these surgeries vaginally, so you don't even have any incision in your belly. And the beauty of these minimally invasive techniques, whether it be robotic surgery, laparoscopic surgery, or vaginal surgery, is that because the incisions are so tiny, when patients wake up from the surgeries after anesthesia wears off, their pain is minimal, their blood loss is minimal. I would say 98% of my patients go home the same day and they're feeling great afterwards, which is
Mm-hmm.
very different from even when I was training, right? A lot has changed. And of course, like I said before, a lot of these surgeries may not be available to somebody who may be in a different part of the country. But again, vaginal surgeries is one of the most oldest form of minimally invasive surgeries that we have. And it's an amazing resource that we have for women suffering from pelvic floor disorder, especially, in say more underdeveloped countries. And then again, knowing that, yes, if you've tried some of the non-surgical treatment options and things are not improving, don't lose hope. There are some amazing surgical treatment options which can really change your quality of life. So definitely seek out the right specialist so you know all the information.
Thank you so much. This has been eye-opening. I did not realize, hadn't really given much thought to the global impact and how profoundly these issues can impact women. It's one thing if you have a 90-year-old and she smells of urine, and I mean you feel bad for her, but a 25-year-old whose husband is going to walk out because she smells like urine, I mean that's an entire lifetime of pain.
Absolutely.
So thank you so much for all the information that you've shared. Now, how do you want people to reach out to you?
Yeah, absolutely. So like I mentioned, I am pretty active on social media. So Instagram, I'm posting pretty much daily. It's Dr. Nabila Noor. I do have a YouTube channel and it's my name again. It's Dr. Nabila Noor. I post weekly videos about a lot of the topics I talked about. And then again, a lot of the things that I see in my office or I'm seeing women suffering from, or actually I hear my girlfriends or friends or family members complaining about, I try to make a video and then educate them. And then also my website, it's drnabilanoor.com. There is a link over there. You can sign up for my newsletter. So that's another way, or another great way to actually have access to some of the resources that I was talking about. So
That's wonderful. Thank you so very much for what you do and for taking the time to be on the show today.
thank you so much, Dr. Hester. I had a wonderful time. I really hope your audience finds this helpful, and thank you for giving me this platform to share my expertise.
More than our pleasure, trust me. You have a blessed day.
You
Bye-bye.
too. Bye-bye.